and welcome. Good day and welcome. We have a very special guest, Dr. Kristen Stroh, and we have our guest here to talk a little bit about our next journal club. Will be the next November 24th. This is our 40th journal club, and we are having a very special topic and a very great paper about the outcome of revisional bariatric surgery after failed sleep gastrectomy, a German multi-center study. But let Christine to talk a little bit about her paper or her team paper, because it's a very, very, very interesting topic for most of us surgeons. So I have a couple of questions for Christine as a teaser for the next journal club we will have in the next couple of weeks. So Christine, what was your motivation for this research to be done and to compare these different surgical techniques for revisional surgery to sleeve gastrectomy?
Thank you for the invitation, Sebastian. Our interest of the study was that we, since 2005, performed the German bariatric surgery registry in Germany, and we have a very large number, about more than 25,000 patients with primary sleeve gastrectomy. And we had the aim to evaluate the outcome of these patients and the outcome of reoperations after sleeve gastrectomy in these patients. You all know that in Germany there's a big problem with the health insurance system, that the reoperation and the primary operations are still not covered or only few covered by the health insurance system. And so it's not possible to perform in the most patients randomized trials. And that's why we try to investigate our data and to collect our data with the registries and the data from the registries, which is very well to collect data and to select patients. But we have also the problem that we have a very high loss of follow-up rate in the patients. But we can compare this data very excellent, that we have no exclusion criteria. And you know, there are papers from Benson Hartz as well that show that the surgery research on registry is similar in the data than controlled randomized trials. And that's why we investigate our patients with the registry. And there was a topic for the interest on the outcome of sleeve gastrectomy and the revisional surgery after sleeve gastrectomy.
Thank you. That's great. It's a problem in many countries. That's an issue in many countries as Germany, and it's a very, very important topic to address, and it's great for you and your team to address it in this way. And then as I was reading your paper, I get this question: what was the main indication for revision in your group? It was weight regain, it was GERD, or it was another comorbidities outside regain or GERD?
Normally, in the most patients, it's the indication for reoperation, the GERD. In this case, it is mostly performed during gastric bypass, but we know that we have in these patients normally perform a pH manometry and a gastroscopy, and that's we try to evaluate further on in our studies. And the second indication is mostly the weight regain in our patients. The readmission and the recurrence of comorbidity is also an issue, but it's not the most important issue. If we found a recurrence on diabetes as well, that's an indication for revisional surgery. We know this, but mostly that's not the main indication. Main indications are reflux and the weight regain after initial mostly very excellent weight loss. And in these patients, we also perform normally an X-ray to show the anatomy, the postoperative anatomy of the sleeve for the indication, as we perform normally in our patients gastroscopy, X-ray, and normally pH manometry and manometry to select the indication for the kind of revisional surgery.
Excellent, great. Yeah, it's a very good sample of what we are experiencing in many of our patients. So we will have to put a pause in the more questions area, because we are not yet in the journal club. This is just a little taste of what we're going to talk and discuss the next November 24th. I'm pretty sure most of our colleagues are very excited to read and to learn more about what your findings were on this paper. So we invite all our colleagues to connect the next November 24th, 2 p.m. European Central Time, to hear from Christine and look what this all the data and all the results from this amazing paper. One more time, congratulations, Christine, for this paper. And we will see you in the next 40th Ifso Journal Club on the next November 24th. Thank you, Christine, for your time, and I will see you in a couple of days.
Thank you, Sebastian. See you in the 24th of November.
Thank you.